आप सुन रहे हैं एबीसी रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
EBC Radio, आपकी चॉइस 1170 AM।
Good afternoon, friends. You are listening to EBC Radio 1170 AM, Aapki Choice, and I'm your host, Alka. And you know, whenever Alka comes on the radio, she brings you a very, very special guest. And again, we have a very renowned person on the radio. We will be talking to him a little later. Let me tell you, you can listen to EBC on 1170 AM, or you can listen to us online, ebcmusic.com, or you can download our free app, which is on iOS or Android, EBC Radio app, or you can also hear us on Alexa. So today, this is a health education series which is brought to you by Robert Wood Johnson, Barnabas Health, and this is very, very close to my heart, this segment, and I believe health is wealth. And if your health is good, you are wealthy. So to talk today, we have a topic, bladder cancer, and to talk on the topic, we have Dr. Vignesh Packiam. Dr. Vignesh Packiam is a urologic oncologist at Rutgers Cancer Institute and Jack and Cheryl Morris Cancer Center, specializing in the treatment of urologic cancers with a specialization in bladder cancer. He earned his medical degree at the University of Pittsburgh and completed a urology residency at the University of Chicago, followed by a fellowship in urologic oncology at the Mayo Clinic. Prior to joining Rutgers Cancer Institute, he built a busy clinical practice and research program at the University of Iowa, performing more than 100 bladder removals each year and gaining extensive experience with advanced intravesical therapies for non-muscle invasive bladder cancer. His research is centered on developing and implementing several new treatments for bladder cancer. He has received funding from the American Cancer Society to improve the safety and effectiveness of therapies for non-muscle invasive bladder cancer. His research also explores biomarkers and precision medicine, finding ways to match each patient with the treatment most likely to help them. In addition, he leads studies on quality of life and novel therapeutics with the goal of restoring patients' bladder function and well-being after treatment. Dr. Packiam has co-authored more than 150 peer-reviewed articles and book chapters. Wow, doctor. Such a great bio you have, and what achievement you have achieved in your, time. So a very warm welcome, Dr. Vignesh Packiam on EBC Radio. How are you doing?
Thank you. I'm doing great, and appreciate you having me on here. I'm really excited to be able to talk to you and your audience today about bladder cancer.
Yes. So as we are talking about bladder cancer, the topic is bladder cancer. So can you discuss some of the symptoms of bladder cancer?
Yes, absolutely. So, one of the troubles with bladder cancer is that a lot of the time it doesn't show a lot of symptoms. It can be subtle, especially in the beginning. The most common symptom or way that bladder cancer presents is painless blood in the urine. So anytime someone has blood in the urine, they should immediately go to the physician. It's really important to make sure that there is nothing going on beyond just a urinary tract infection. Mm-hmm. Oftentimes, some men and oftentimes women will have a delay in diagnosis of bladder cancer if the blood in the urine is thought to be from urinary tract infection. So it's always important to see a urologist in addition to the primary care doctor to take a closer look and make sure there's nothing else going on. The other symptoms that can sometimes happen, especially if bladder cancers get very large or it fills up most of the bladder, is that patients can sometimes have pain with urination, sometimes irritative peeing symptoms like feeling like you have to rush to the bathroom or you're leaking, or sometimes burning with urination. Those are also sometimes symptoms that can happen, but really the most common thing is visible blood in the urine.
So, doctor, as you said, leaking or going more often to the for urination. So, like many times people see that when they are diabetic, so they do
Yeah.
feel those kind of symptoms. So, how do they differentiate between that?
Yeah, I would say the vast majority of the time, if patients are just having voiding symptoms, it's not from bladder cancer. So it's really when those symptoms are unexplained is when we have to look a little further to see if it's bladder cancer or not. The other test that can sometimes be useful to help see what's going on is to check for microscopic blood in the urine. So we can check for that just by doing a urinalysis and looking for blood there. If there's no blood inside the urine microscopically, there's a very low chance of there being bladder cancer.
Mm-hmm.
And most of the time, that's one of the tests that's ordered when people have troubles with urination.
So again, from my side, doctor, I would like to ask this question, like, is this test part of your physical checkup, or does it needs to be ordered if there are any symptoms?
Yeah, that's a good question. It's not a standard part of the workup. I think it just depends on, your primary care doctor's philosophy and how aggressive they want to be with testing.
Mm-hmm.
As you probably know, there's some primary doctors that order very few tests and others that love to order a lot of tests. So this one isn't one of the mandatory testing,
Mm-hmm.
but it's usually a good idea if there are any symptoms.
Okay, great. So how does bladder cancer get diagnosed?
Yeah, so, once there's a concern for the possibility of bladder cancer, or if we want to work up a situation where there's visible or microscopic blood in the urine, there's really two main steps for diagnosing bladder cancer. So the first step is to get a special type of CAT scan called a CT urogram that has 3 phases to it. One where you pass through the scanner without any contrast. That looks for kidney stones. Then the next phase is the enhancing phase where they give contrast. That's where we look for masses in the kidney or tumors that may be lighting up somewhere in the urinary tract. And then the third phase is something called a delayed phase. That's when the contrast goes into the urine, and then it shows us places where it's not filling in the collecting system, so we can look for places where bladder cancer may be. So that's a very useful test, and it's really the first step when we're trying to diagnose bladder cancer. The second step is something called a cystoscopy. Cystoscopy is where we take a small flexible camera and look inside the bladder. Most of the time we do this in the office. It's a little invasive because it's a small device about the width of a pencil, but it's usually not painful, and it's quick. It takes about 30 seconds. We look around the bladder to make sure there's nothing going on.
Mm-hmm.
A lot of patients ask me, well, we have a CAT scan. Why do we need this other test? The reason for that is sometimes bladder tumors can be very small and too small to be detected with the CAT scan, but we're able to see them very easily with the actual camera. And bladder cancer, it's very important to detect it early so that we can treat it more effectively and reduce the chance of it coming back.
All right. So, doctor, what are some of the treatment options for bladder cancer, and are there new approaches for managing bladder cancer?
Yeah, it's really a very exciting time for bladder cancer treatment. I'd say before 10 years ago, there wasn't a lot happening with bladder cancer for the 20 to 30 years before then. But in the last 10 years, we've seen a lot of advances both with our surgeries and the treatments that we can use for bladder cancer. So, when we're really starting as the first step, usually the first step is to remove the tumor, and we do that endoscopically. So we take a special instrument to look inside the bladder while the patient is asleep, and then we use a loop to kind of remove or resect all of the tumor from the inside. This is all endoscopic, so there's no incisions on the skin or anything like that. And once we remove those, then the pathologist can take a look under the microscope to make their diagnosis and tell us what kind of cancer we're dealing with. But the removal, that endoscopic removal, is therapeutic by itself also. That's part of the treatment for bladder cancer. So we've had a lot of nice advances in how we do that. Mm-hmm. At Rutgers, we use a special technology called blue light cystoscopy. That's where we put a special chemical into the bladder that gets taken up by bladder cancer cells, but not the regular bladder. And when we switch the wavelength of light, it actually causes the bladder tumors to glow bright pink. And studies have shown that because of this technology, we actually find 30 to 40% more tumors than kind of the standard white light approach, which reduces the chance of the cancer coming back. So there have been some really cool advancements in technology to help surgery be more effective for bladder cancer. And then on the other side, usually the next step after we kind of endoscopically remove the cancer is to put medicines inside the bladder to keep the cancer from coming back. And for a long time, we only had, one or two decent therapies. And in the last 5 years, we've already had FDA approval of, 4 or 5 new treatments. There's new types of treatments that we can give and new drug delivery devices to help the treatments work better also. So it's a very exciting time to have all of these new options.
That is fantastic, doctor, to hear that you can treat it inside and it will prevent for cancer to come back. Mostly I hear from people who have gone through the cancer that it does come back often. So the treatment, what you have come up with, the new treatment, you could really kill most of the cells in the bladder, right?
Yes, that's a really good point. This cancer, it's prone to coming back very often, but these newer treatments are getting more and more effective at both keeping the cancer from coming back, and if it comes back, we have more options that we can use as a backup. It used to be the case that once the first treatment doesn't work, that we have to resort to actually removing the entire bladder because we didn't have anything else effective to kill the cancer and also allow the bladder to stay in place. But now, thankfully, that's becoming less and less common. It's pretty rare that we have to do that when the cancer is not invasive.
All right. Friends, if you have just tuned in, we are talking to Dr. Vignesh Packiam, and the topic of discussion is bladder cancer, and the segment is Health Education Series, which is brought to you by Robert Wood Johnson, Barnabas Health. So, doctor, my next question comes to you is, how does bladder cancer impact the South Asian community?
Yeah, that's a really good question. Of course, there's so many South Asians here in New Jersey, but elsewhere in the United States and all over the world. We don't fully understand the different demographics and populations that bladder cancer impacts. In the United States, a lot of research has been done on Caucasians and patients who are white, and we know that that's, at least here, the most common community that's affected by bladder cancer. But it absolutely affects South Asians as well. I think that's something that we need to study more, and I have plenty of patients that are South Asian that have been impacted by this. So really, the recommendations I made in the beginning about keep monitoring very closely for blood in the urine, very applicable for South Asians.
And I think, doctor, as you mentioned, I guess the data doesn't show much about South Asian community, even though our community is growing every day.
Yes.
The reason what I feel personally is when you go to see the physician, there is no section. When you see the doctor first time, you need to fill up the form. And there is no section where you fill as South Asian or Indian or any ethnicity of that nature.
That's a really good point. Well, when we do our research studies, a lot of the time we're going into the medical record and extracting the information that we have. And like you said, when we check off the forms, a lot of the time it'll generically say, Asian, and it won't let us specify where we're from.
Right. So as a physician or whoever you can reach out to, you should enforce them to have a section, because that is what the data entry people do that, right? If the section is not there, so South Asians are not counted. So,
absolutely.
Yeah. So, all right. So why should listeners seek cancer care at NCI-designated comprehensive cancer center like Rutgers Cancer Institute and Robert Wood Johnson Barnabas Health?
Yeah, I'm so proud to work here at Rutgers. We have, a very cutting-edge research program, which also informs our clinical program. So when patients come here, I feel like I can offer them the very best surgical treatment, pharmaceutical treatment, and just give them the best well-rounded care. And there's some situations where we don't have to offer any kind of research or exploratory types of treatments, but I'd say about half the time, or maybe even more, patients do benefit from our research programs and clinical trials and some of the new things that we're exploring. So I think these are all benefits of coming here. The other really nice thing is that, everyone here is kind of an expert in what they do. So, it's so important to have strong doctors in the community, and, they do a lot of the work in helping to find cancers and problems in the beginning. But, there's something special about seeing a specialist that has kind of dedicated all of their time and energy towards one problem, and coming somewhere like Rutgers Cancer Institute allows patients to have that expertise.
And now there is a beautiful new hospital next to that is Jack and Cheryl Morris Cancer Center, which is brand new with full of all the great facilities and equipments. I was there on the ribbon cutting day, and we took a tour. It was beautiful, beautiful. It doesn't feel like you're in the hospital.
It's beautiful. Patients really love it. Every time they come, they are really impressed by it, and it also kind of calms them down also. It was a hospital that was built for patients. I think they had a lot of patient input also. So you can kind of see that in the aesthetics. It's a very calming, kind of peaceful environment, which is great.
That's what you need for these patients. They need more stronger willpower to, get treated and get recovered faster.
Yes.
Yes. So, Doctor, now in the end, before I let you go, I would like to ask you to tell my listeners how can they prevent this cancer, bladder cancer, or if they have it, how can they ease it or rush to get their treatment or, diagnosis done faster?
Yeah, very, very good questions. By far, the number one preventable cause of bladder cancer is smoking. So that's probably the biggest area where we focus on prevention. Stopping smoking, or the best is to never start smoking, is the best way to decrease your chance. Even if someone is already a smoker or exposed, we know that time since you quit will decrease the chance of cancer as time goes on. So if someone quit a year ago, they're already going to have a lower risk of developing bladder cancer. If someone quit 10 years ago, it's an even lower risk. So the longer that you're able to quit, the better it is. I think that's really hopeful for people that already have some exposure. The other kind of modifiable exposures, we're just starting to learn about new things with processed foods, or microplastics is a really hot topic. Even though smoking in the United States has gone down significantly over the past 10, 20 years, the rates of new bladder cancer diagnoses are actually almost the exact same. About 80,000 people are diagnosed a year in the United States. So we're starting to research, why is that? Is it some other exposure that we don't know about? And we're starting to find some interesting research about microplastics causing a lot of these problems. So I think we're just starting to learn about that. We need some more research to give us better recommendations for what to do and what to avoid to help not get this cancer. And then, really the most important thing to help find the cancer in a timely way so that it doesn't require a lot of treatment or it's very treatable is to immediately go to the doctor when there's blood in the urine, really advocate for getting more in-depth testing other than making sure it's not a urinary tract infection.
So, Doctor, I'm just going back to your earlier answer. Like you said, it's a microscopic blood found in the urine. So would it be one who would be able to see, or how do they think that is blood?
So that's a good question. So there's two types of blood in the urine. One type is visible. We also call that gross hematuria. I don't know how that word came out, but visible or gross blood. That's pretty obvious, where, you should see a urologist and they should do one or both of those tests, the CAT scan and looking inside the bladder with the camera. Microscopic blood in the urine can be a little bit more tricky. So basically, that's a urinalysis where you pee in a cup, and they look under the microscope to look for red blood cells. And if it meets a certain cutoff, usually it's 3 or more in their little field that they're looking at, then they know that there's microscopic blood in the urine. And when that happens, we have special guidelines that say if you're low risk, it's okay to just repeat that before we do more invasive testing. If you're high risk, we have to treat it almost like visible blood in the urine, where we're going to do that special CAT scan and look inside the bladder. But, like I said in the beginning, just because there's some peeing symptoms, most of the time that's not because of bladder cancer, but a very cheap and easy non-invasive test to make sure there's nothing else going on is that urinalysis test, where they can look for microscopic blood in the urine.
All right. So thank you so much, Doctor. And I first want to thank Robert Wood Johnson Barnabas Health for really sponsoring this health education series and bringing so many great doctors on EBC Radio to educate our listeners and make them more aware of so many different kind of diseases and keep them healthy and warn them what they should not do or what they should be doing in their daily life. Life is too busy in this country. So again, I'm looking forward to speaking to you in near future, Doctor, and happy Navratri to you, and stay well.
Yes, thank you so much. Great to chat with you, and we'll be in touch.